So, hello everybody. Today I will be talking about the test for joint dysfunction for the lumbar spine. So, myself, Dr. Sneha Bhatia, MPT in Orthopedics and Sports Rehabilitation, in charge principal at Lee Srimati S. Patel Institute of Physiotherapy, Dharmash. So, the first test for the joint dysfunction for the lumbar spine is the one leg standing lumbar extension test. It is also called as Stork standing test. So, in this test, the patient stands on one leg and the examiner will be extending the spine while the patient is balancing on the other leg. So, as you can see in this picture 9.72, here we can see that the patient is trying to stand on one leg, trying to maintain the balance, and the examiner is standing posterior to the patient. So the patient stands on one leg and then performs extension of the spine. So the test is repeated with the patient standing on the opposite leg. So first you have to ask the patient to stand on right leg and then you have to ask the patient to stand on the left side leg. So a positive test is indicated by pain in the back and is associated with a pars interarticularis stress fracture and also in case of spondylolisthesis. So in this position, if the patient is complaining of pain in the back or there is any discomfort or if the patient is not able to maintain this position, then the test, that is the Stork standing test, will be considered as positive. If the stress fracture is unilateral, standing on the ipsilateral leg causes more pain. So that's what they are trying to say, that suppose there is a stress fracture in the lumbar spine and it is only on the one side. Unilateral means only on the one side. Bilateral means it is on both the side. So if the stress fracture is only on one side of the lumbar spine, then the same side leg will have more pain. For example, there is stress fracture on the right side, then when the patient is standing on the right leg will pain more. If the rotation is combined with the extension and the pain results, it is an indication of possible facet joint pathology on the side to which the rotation occurs. So now they are talking about the facet joint pathology. So in this test, that is the one leg standing test, patient is standing on one leg and we are asking the patient to do lumbar extension. Now while performing lumbar extension, if we ask the patient to rotate to the right side, so if we ask the patient to rotate to the right side, then the pathology will be on the side to which the rotation occurs. Okay, so whichever side we are doing the rotation movement, that side possible facet joint pathology may be present. So it is a very simple test, easy to perform and easy to assess also. So simple, it is the patient standing on one leg trying to extend from the lumbar spine. If the patient is having pain in the buttock, then it is considered as positive test. Also, this test can be combined with the rotation component. So, patient will be again standing on one leg and then you ask the patient to do the lumbar extension as well as you have to ask the patient to do rotation. So, if the combination of the movement of the rotation and the extension is giving pain to the patient, then there can be possibility of the facet joint pathology. Okay, so now next I will talk about the quadrant test. So what is a quadrant test? The patient stands with the examiner standing behind. So as you can see in this picture 9.37, patient is standing in the front and the therapist is standing behind the patient. So the patient extends the spine while the examiner controls the movement by holding the patient's shoulder. So here the patient is again asked to do the extension of the spine, and what the therapist is doing, therapist is placing both the hand on the patient's shoulder and therapist is trying to control the movement. The examiner may use his or her shoulder to hold the occiput and take the weight of the head. So here you can see the patient's occiput is on the therapist's shoulder. Okay, so the therapist may ask the patient to rest his head over the shoulder of the therapist. So overpressure is applied in extension while the patient side flexes and rotates to the same side of the pain. So suppose here in this picture we are seeing the patient is bending towards the right side. So extension can be performed along with that side flexion towards the right, and there is also the component of rotation to the right side in this picture. So the movement is continued until the limit of range is reached or until the symptoms are produced. So you have to ask the patient to perform the movement till the limitation of the movement. Limitation of the movement means patient should try to extend or try to rotate as far as he can do. There will be a point further to which the patient will not be able to side flex or to rotate or to extend. So the patient can stop there. But as far as possible, the therapist should instruct the patient to extend and then to rotate and side flex as far as possible. Overpressure can be applied by the physiotherapist. So until the symptoms are reproduced, we have to perform this movement. Now, the position causes the maximum narrowing of the intervertebral foramen and stress on the facet joint to the side which rotation occurs. So what they are trying to say, when we are performing this movement, that is the extension, side flexion and rotation, what is happening? They are saying there is narrowing, okay? Maximum narrowing of the intervertebral foramen and stress on the facet joint to the side which rotation occurs. So here in this picture we can see our patient is rotating towards the right side. So the right side rotation is taking place and towards that side there will be narrowing. So the test is positive if the symptoms are produced. Okay. So when you will consider that the quadrant test is positive, we can consider that the quadrant test is positive when the pain or the signs and symptoms which the patient is otherwise experiencing, the same pain and the symptoms are reproduced by this maneuver, then only the quadrant test will be considered as positive. Okay, so it is a very simple test. Again, therapist is standing behind the patient, patient is in standing position initially, then you ask the patient to do extension and then to do rotation as well as side flexion towards one side. So what is happening when we are performing this combination of movement? There is narrowing, there is maximum narrowing, okay, of the intervertebral foramen, and facet joint pathology also may be present if this test is coming positive. Okay, so next I will talk about the Schober's test. So what is the Schober's test? I think this test all of you must have also learned during the first year goniometry class, because when we are teaching goniometry is the procedure by which we are measuring the range of motion of different joints. So when we are checking the range of motion for the lumbar spine, that time this test is performed. So what is the Schober's test? The Schober's test may be used to measure the amount of flexion occurring in the lumbar spine. So how much lumbar flexion is taking place? To measure that, we are performing the Schober's test. A point is marked midway between the two PSIs. So you have to mark a point between the two PSIs. So where is the PSIs? At what level it lies? So PSIs corresponds to the dimples of the pelvis, which is the level of the S2 vertebra. So if you want to palpate the spinous processes, then you can palpate the S2, and then points 5 centimeter below and 10 centimeter above that level are marked. So what we have to do? First we have to mark the S2. Okay, so we have to mark a point that is between the two PSIs, that is the S2 level. Okay, now after marking the S2 level, the second step is below S2 5 centimeter we have to mark a point, and then above S2 10 centimeter above S2 we have to mark a point. So we have marked 3 points here. One is at the S2 level, one is at the 5 centimeter below the S2 level, and the third point which we are marking is 10 centimeter above the S2 level. Now the distance between these 3 points is measured. The patient is asked to flex forward and the distance is remeasured. So first we have to mark these 3 points. One is the S2, then 5 centimeter below S2 and 10 centimeter above S2. Now when the patient is in normal standing position, when with the spine in neutral position, we have to mark the distance. Okay, we have to take the distance of between these 3 points. Then we have to ask the patient to forward flex. Flex forward, or we can instruct the patient to touch forward or bend forward and then try to touch the floor with the fingers. So while the patient is doing the lumbar flexion movement, again we have to mark the distance between these 3 points. So in this case, when the patient is in forward bend position, this distance will increase. So that tells us the amount of lumbar flexion. So the difference between the two measurement is an indication of the amount of flexion occurring in the lumbar spine. So modification of the Schober's test to measure the extension is also present. So after completion of the flexion movement, the patient extends the spine and the distance between the marks is again noted. So little also advocated using 4 marking points. Okay, 1 below the dimples and 3 above, with 10 centimeter between them. But practically what we are using in OPD setting and for routine examination, what we are using is the not the modified one but the basic Schober's test we are using. Here I will repeat again. First point, you have to mark between the two PSIs, that is the level of the S2. Then you have to mark the second point, which is 5 centimeter below the level of S2. And the third point which you are marking is 10 centimeter above the level of S2. Okay, so then you measure the distance first in the normal standing position, and then secondly you can ask the patient to do the lumbar flexion and then check the measurement. Again you can ask the patient to do lumbar extension and then check the measurement. Okay, so that is about the Schober's test. Each step can be used to mark the distance. The next test for the joint dysfunction is the Yoeman's test. So what is a Yoeman's test? The patient lies prone while the examiner stabilizes the pelvis and extends each of the patient hip in turn with the knees extended. So what here patient therapist is doing? First of all, the patient is in prone lying position. What the examiner is doing? First he is stabilizing the pelvis and then you have to extend each of the patient hip. So in turn that with the knees extension. So knees you have to keep into extension and then you have to do the extension of the hip joint. The examiner then extends each of the patient's leg in turn with the knees flexed. So first you have to do hip extension with the knees in extended position. Then you have to do knee flexion and then perform the hip extension position. In both the cases, the patient remains passive. So here the therapist is performing the maneuver. Okay. So the patient is remaining passive. A positive test is indicated by pain in the lumbar spine during both part of the test. So while you are performing this maneuver, if the patient is having pain or the signs and symptoms which he is otherwise experiencing, same signs and symptoms are reproduced again, then this Yoeman's test will be considered as positive. Again, I will repeat, it is a very simple test to perform. Patient will be in prone lying position. You have to stabilize the pelvis. Therapist will be stabilizing the pelvis. First, you have to extend the knees. Both the knees should be in extension and then you do the hip extension movement. Now, if the patient is having pain while you are performing hip extension movement, it will be considered a positive test. Secondly, what you can do is you can do knee flexion. So first do the knee flexion movement and then try to do the hip extension again in this position. If the patient is having pain, discomfort or any signs and symptoms are reproduced, then this test will be considered as positive. Okay, so that is the Yoeman's test to check for the joint dysfunction. Next is the Milgram's test. So how to perform the Milgram's test? The patient is in supine position here, opposite to what it was in Yoeman's test. For Yoeman's test, the patient was in prone position. For Milgram's test, the patient is in supine position and actively lifts the both legs simultaneously off the examining table around 5 to 10 centimeter, holding this position for 30 seconds. The test is positive if the limbs or affected limb cannot be held for 30 seconds or if the symptoms are reproduced in the affected limb. So what here the patient is doing? Patient will be in supine. Now see the difference between the Yoeman's test and the Milgram's test. Yoeman's test was a passive test. Why? Because the therapist is performing the movement of hip extension. The patient is remaining passive. In the Milgram test, it is an active test. So therapists have to ask the patient to lift the leg 5 to 10 centimeter off the couch and then hold that position for at least 30 seconds. If the patient is not able to hold the leg in the air, okay, for 30 seconds, or the signs and symptoms are reproduced, then this test will be considered as positive. This test should always be performed with caution because of the high stress load placed on the lumbar spine. So while we are performing the SLR position, okay, see here it is written that simultaneously you have to do this maneuver. So bilateral SLR, we are not doing it together simultaneously. So one by one also you can check. So while we are performing this test, it is putting a lot of stress on the lumbar spine. So we have to be careful while performing this test. Why? Because the patients who are coming to us with the complaints of low back pain, they are already having any history of trauma, or any stress fracture can be present, or there will be pain which will be severe pain, debilitating pain, due to which the patient is not even able to sit, stand or walk. And if you do the test and it is provoking the pain of the patient, and it is very severe, and if you are not in a position to relieve that pain instantly, then the patient will be in trouble. Patient may experience more pain. So that is why we have to be very careful and choosy while we are selecting a test. When we are selecting a particular test to perform on the patient, we have to think whether all the tests are required or not. See, till now I have told about quadrant test, Stork standing test, Yoeman's test, Milgram's test. So already four tests I have told you about. But that doesn't mean that the patient comes to you with the lumbar spine dysfunction and you go and do all four tests. No, it is not necessary. You can just choose one test and then perform it. If you are suspecting the pathology that test is coming positive, then you can confirm your findings with the observational and palpation findings and with the other examination that you do during the orthopedic assessment. So when the patient comes to you, just select a test which is having high sensitivity and high specificity. Just do that one test or maybe two. If you are in doubt, then you can do at least two tests to confirm the diagnosis. But don't go to perform all the tests on the patient and provoke and increase the pain of the patient. So the next test is the Mckenzie side glide test. So here you can see in this picture 9.74. Here this is the picture showing the Mckenzie side glide test. About this Mckenzie test I have already spoken about in my video series, which is on the Mckenzie diagnosis method, okay, MDT, mechanical diagnosis and treatment. So there is one playlist in my YouTube channel on the Mckenzie diagnosis and treatment method. So you can also see those videos to get more insight on Mckenzie method of diagnosis and treatment. Mckenzie method is very effective and it is most commonly used nowadays to treat the patient with the lumbar spine. It is showing great improvement in the patient and showing better results in less time. That is why Mckenzie method of diagnosis and treatment is most commonly used for the lumbar spine patient or the patient with low back pain. So Mckenzie side glide test, the patient stands with the examiner standing to one side. So you here the patient will be in standing position. You are standing on the one side of the patient. Now the examiner grasps the patient pelvis with both the hands and places a shoulder against the patient's lower thorax. So here you can see both the hands of the therapist is over the opposite side pelvis. Okay. So you have to hold the pelvis of the patient with both the hands and the shoulder against the patient's lower thorax. So here you can see the shoulder of the therapist is stabilizing the lower thorax of the patient. So using the shoulder as a block, the examiner pulls the pelvis towards the examiner's body. So from this hand, which are placed on the pelvis, so what the therapist will do, therapist will pull the pelvis towards the examiner body, towards the therapist. Okay. So the position is held for 10 to 15 seconds and then the test is repeated on the opposite side. So you can do here, we can see a therapist is performing the test on the left side. Okay, therapist is standing on the left side and trying to take the right side pelvis. Okay, trying to take the right side pelvis towards her. Then what she can do, she can come this side, she can stand on the right side and then perform the same test. So while you are taking the pelvis towards you, you have to hold it for 10 to 15 seconds. Now if the patient has an evident scoliosis, the side to which the scoliosis curves should be tested first. So if the patient is having scoliosis and you are suspecting the patient is having scoliosis, or on observation you are sure that the patient is having scoliosis, then you have to perform this test first on the side on which side the scoliosis is more evident, okay, more prominent. The side to which the scoliosis curve should be tested first. So the positive test is indicated by increased neurological symptoms on the affected side. So what will happen is the examiner draws the pelvis of the patient towards herself, there will be neurological symptoms. What are the neurological symptoms? Tingling, numbness, burning sensation, radicular pain. Radicular pain means the pain will start from the lumbar region, it will radiate to the buttock, posterior aspect of the thigh, posterior aspect of the calf, till the sole of the foot. Okay, so patient may also have tingling and numbness traveling down till the sole of the feet. Okay, so if this kind of neurological symptoms are reproduced, then the test is considered as positive. It also indicates whether the symptoms are actually causing the scoliosis. Okay, so that is the Mckenzie side glide test. Very simple. Patient is in standing position, therapist is standing on one side of the patient. Therapist is placing both the hands on the patient's pelvis, and the shoulder of the therapist is blocking the lower thorax of the patient. You have to push and you have to pull the pelvis towards yourself and hold that position for 10 to 15 seconds. If the patient is having neurological symptoms like burning sensation, radicular pain, tingling, numbness, going symptoms are traveling down the leg, then you can say that this Mckenzie's side glide test is positive. Okay, so that is all what I have told you today is about the test for the dysfunction. So I have told you about the quadrant test, about the Stork standing test, or it is also called as one leg standing test, Yoeman's test, Milgram's test, and Mckenzie's side glide test. So thank you for watching this class. If you have enjoyed, then please subscribe to my channel and share it with your friends. Thank you.